talk on bearings in the hip joint replacement, which in my opinion is a very important topic. But the first thing, looking at the slide, please don't assume it is a Latin class or how these two words have changed the known Western civilization, as the legends would tell us. The reason for this is that this is the topic most valued in the any hip society meeting, and in 8 minutes time I will like to touch, not going into the details, and I hope in the next few meetings the young Turks like Samir and Gaurav will take up the research and we'll have a long debate about this topic. All hips will fail. That is the one thing we need to understand. Being compensating ourselves that I have used the best evidence-based medicine and these biologs and highly cross-linked has got the best outcome. I think we need to think further than that. 10 to 20% longevity, we are happy with that. But what is the cause of the failure? And I'm not going into the intricate details of the pore size and what happens, but we'll just cover some major stuff. And those young students, they might find we are going around the circles. But like this hip, which has failed, what are you expecting and how to interpret it? Whether there is a loosening, has the stain been very well fixed? Whether a normal ETO will do this is the third surgery for this young lad who is just 30 years of age. So we'll briefly discuss about what happens with the hip, which are not performing as per their expertise. And one would have thought that by doing a simple osteotomy you could have taken out the stain, but that is exactly not the case because the stain was very well fixed. So to recollect once again, all hips have got a limited life, especially when they are doing it at such a younger age, and longevity is going to cross 100. And basically it comes down to two types of response. First is the innate response. Innate response was not even considered as an innate response. We used to call it as a plaster disease because the main crux was we used to think this cement disease, cement is the root cause of all the problems. Because this polythene is very hard to detect even in the cells. And as my colleague previously mentioned, it's an inflammatory response with giant cells and macrophages, and it is just trying to eat it up. Most of the interest we gathered is from metal on metal resurfacing. And what we have noted is the adaptive response. It's basically a perivascular lymphocytes. I'll just touch briefly upon it, and plasma cells, and again the macrophages. Some questions we need to ask that why these hips are failing. Because we cannot rule out the immune response of the body from this, and we have to think in that particular direction. These are some of the questions which are posed, and the answer, they tend to be repetitive for each one of them. Like first one, are the patterns of inflammation around failed metal on metal hips is very unique when compared with other articular combination. We always thought metal on metal is something very evil, and that is because of the articulation and the metals falling down and causing all these alveolar and pseudo tumors. Physician was the first one to mention that even those with a metal on soft pairing will also have metal and a picture similar to metal on metal resurfacing arthroplasty, albeit to a lesser extent, when they start failing. Second question which we need to ask is, all failed metal on metal hips show histological features suggestive of immune response. Much more than that, it has got lymphocytes, which we expect in a chronic stage, both B and T, plasma cells, and sometimes even eosinophils. Again, while we are deciding about what is the best bearing surface, and I have to say, our knowledge is very limited, and there are very conflicting studies pointing in different directions. Or sometimes of the debris are more likely to be associated with the histological features suggestive of immune response to help select the best bearing. Again, the answer is always the same. It is adaptive immunity, and whenever there is a metal fall, especially at the trunnion or a ceramic ball with a metal neck, it is going to cause this problem. Tunneliosis was the another thing which was very hotly debated. So just to see how the metal can be incorporating from this wear at this level which we never thought of before. Neutrophils. Another thing, when you look into that, our lab is not particularly exciting when it reports the histopathology of our revision hips. How much are the neutrophils? Do they indicate a low-grade infection? Because when I tried to look into the leukocytes label scan, I don't know, it was not very widely available till then over here. How much are the neutrophils you need to contribute? More than 10 is fine. Somebody might say 23. But the bottom line is that metal and metal will have neutrophils, but mostly it is aseptic. That is the thing you need to understand, because sometimes there is a tremendous confusion whether it's a low-grade infection on the top of that, and how you should be addressing these revision issues. Coming back to the polythene from where we started, and we failed to notice what it is all about, and it is a root cause of evil. It will fear by abrasion, erosion, or by fatigue, and loss of 0.1 millimeter per year could be catastrophic. Routinely, postgraduates will get a short note on highly cross-linked, how they are oxidized, they become very hard, less shedding, adding vitamin E further acts as a stabilizer. So that is the one way to look into that. Different types of bearing, we all know about that, ceramic on ceramic, metal on metal, and the hybrids of these two. Our biggest interest came with metal on metal resurfacing. See, metal on metal resurfacing is not something we were not accustomed to. The initial hip started with resurfacing by fascial lata. Then in Burma, we got these ivory pegs being put in with some very good results. Initially, Sir John Chonley also tried with Teflon, but he dismissed it because of excessive particle wear. So when this metallurgy improved, we got this metal on metal resurfacing. But the biggest problem was this metal particles and the problems because of that. First, they put a cup on a Thompson's and metal on metal hip arthroplasty and resurfacing. What is the difference? Although it might not be failing, it will still show high chromium levels at 3 years. Although they might be symptomatics, and high levels of toxicity could be associated. We know even myocardial toxicity has been associated, more so with the metal on metal resurfacing. Ceramic is extremely rigid. We have gone a long way from aluminum and zirconia. How now they have become scratch resistant and less of a squeaking, although squeaking is an issue. And when you, this is our most common practice. At least I use biologs with cross-linked, and most of us are using it, I assume. But see, the evidence is pointing in another direction. Ceramic is very hard. Cross-linked still doesn't have a fatigue coefficient which is not matching. Ceramic and ceramic is also equally good. So we have to choose between the two. And even Sir John Chanley's low friction arthroplasty, there are 30% and 40% survivorship at 70 years or something like that, and 90 years of age. So that is another confounding. Maybe we are looking at those who are survived well. These are the, just 1 minute please. Oxynium, zirconium coated, nobium coated with zirconium, tantalum, the new material, low friction, modulus of elasticity almost to the bones. Hydroxide coating again has got very not so promising reviews because of the loosening associated. Many young people will think metal on metal is very bad. You must think twice. If the patient wants to do impact loading exercise like this Scottish tennis player, Birmingham hip resurfacing has never been pulled out. It is the other company. And what are the indications? Impact loading, young adult, head size, female, more of a problem. So still you can do surface on surface resurfacing. And maybe Mr. Dhar and other people will decide which centers they should be allowed. They should not be totally abandoned. Birmingham hip resurfacing has got very good reviews. What is the future? We are not looking into the cellular and the cartilage.
Can you summarize please quickly?
Yeah.
For
Just these are the
time?
high resistance, low friction, biocompatibility, and that's all about it. Thank you.